Hi, I'm Nicole Webb Bodie, partner at Healthcare Plus Solutions Group. I had the pleasure to sit down with Quint Studer, our co-founder, for an insightful look back at the history of what has become the focus for so many organizations in the industry: experience and engagement. Whether you've known Quint, worked with him, read his books, or even heard him speak, you undoubtedly know he has been called one of the best friends to healthcare. If you don't know Quint, you likely know and use many of the tools that he created and implemented at healthcare organizations across the country. Please enjoy this short clip from our conversation. To watch the full video, you can visit our website and our learning library at www.healthcareplussg.com. Post-pandemic, and actually during the pandemic, you wrote The Calling, and then after The Calling, then you wrote Rewiring Excellence. Talk a little bit about how you feel like that fits into healthcare post-pandemic and why you felt the need for that book after Hardwiring Excellence.
Well, I think the first book was The Calling. I spoke at TriHealth in Cincinnati, and I spoke leadership is an inside job. And I really believe that. I think growth is an inside job. I was talking to a fellow this morning about don't let his ego get in the way. And that's a book on replenishment, because I felt during COVID, the big thing is how do we replenish ourselves and others? Not knowing I was going to write Rewiring. But then as I went out, because I went out and I met mostly with middle managers and frontline workers, a lot of them, because again, all the visibility. And as I talked to them, I realized how new they were and how overwhelmed they were. And so that got me into Rewiring. But they kept talking about, and I like all my books, they kept talking about my own, but you said it was 30 and 90 days. But you said we should round and ask these questions. And seeing I wrote the book, I decided I had to like disrupt the book, not to be hurtful, because there's still many great things in it. The themes are right. But we got to change. We're using different phones. We use different techniques. I remember when I traveled, I'd have a MapQuest. I was so excited to have that. I don't have that anymore. So we wouldn't do that, but yet we had a rough time get out of the past, because it's habit forming, which is good, but it wasn't, because we had so many new people. So I decided I need to help people realize it's okay to change. So I would look at things, and we'd look at things like 30 and 90 day, and we found out that's not relevant for many areas. We looked at nurse managers particularly, and we asked them how many patients they thought they could round on every day, and we found out what was being asked was pretty much impossible. We started digging into questions. Are these questions still relevant? We found out some were not. That University of Colorado study to us showed the most important question is what's your biggest concern or worry right now, because now it's a relationship question. We found with employees, you just don't say, how are you anymore? Because they say fine and they're not. That became the battery check that we've been talking about so much. We really geared into the emotional growth of every individual. So I wrote this book really giving people permission to take a fresh look at things with fresh eyes and be okay stopping. You know, our part in healthcare is we don't like to stop anything. Right. We add, but we don't subtract. So I wanted people to subtract things and really narrow the scope. And then they can add it. Somebody comes up to me and says, well, I like to ask 8 questions, and ask 8 questions if it works. But most of the time it doesn't. So we really find how to narrow the scope and do the diagnosis. And that led us to things like emotional onboarding now. It all ties down, it's still the same thing. I don't care what you call it. It comes down to creating great places for patients to get care, employees to work, and physicians to practice medicine.
And it goes back to where we started, where it's about the people. It all comes down to the people being able to create those relationships.
And to feel cared for. And that's why I wrote the book Trust with Dr. Catherine Mace. Because after Rewiring, again, because I'm out and about, Dan Gentry, who's the president of AUPHA, which provides resources for colleges, says, you should meet Catherine Mace, because you love research. So, and I had worked with the ANA, Katie Boston Leary, on the care model study with Jocelyn Insights, which, again, for nursing, because that's sort of where my heart's at many times. So I started looking at the trust issue, and that's a relationship issue. That's a caring issue. And so that's what we're really focused on. How do you build trust? Because if I trust my doctor, I'm more compliant with I asked my doctor one time, do you think people follow what you recommend? And she said, yes. And I said, well, research shows that many people don't, but why do you think yours do? And she really talked about how the time she takes to get them to be trustworthy for her recommendations. So trust is a real key issue, because if we have trust, people are more willing to try something. They're more compliant. They're also more willing to give us feedback on what's not working. So I call my last 3 books the trilogy: The Calling, Rewiring, and Trust.
What I love about The Human Margin, the Trust book with Dr. Catherine Meese, is you get the research side, but then you also do the applied side. So how do you take the research and what can you do to make an impact in your organization?
And she does it too. You know, Catherine's a unique individual because she's just not a researcher. I mean, that's where we really connected. I'm more of an applied person that does some research, and she's a researcher, but is also skilled in applying. So how do you create the feeling of autonomy? How do you feel the fact that I like the corporate? Because that's the big issue in the book of Trust, is the fact that due to COVID, due to all the changes, people don't have the trust they used to on the senior executive team. They might not feel they have organizational support. They don't feel they're being cared for. And I'm a big EAP well-being, but well-being is way beyond, do I have resources? It's, do we have staff? Do we have resources? Do we have communication? And then, do I feel recognized? And what really just moved up the chart was a sense of belonging. And that's what we work a lot on. The front of our human capital ecosystem is create cultures where people feel they belong. When I finish a talk, I do different ends. One of the ends I did recently was, I want people to feel in an organization that I don't want to ever work anyplace else. I want patients to feel I don't want to get care anyplace else. I want doctors to feel I don't want to practice medicine anywhere else. So that's this wild journey, and I'm still happy to be on it. And I just am excited, because I think a lot of people in the field, different history, and it didn't start in 2000 this, 2000 this. Really, it even became, I started in 1993, but people like Irwin Press and Rod Gainey and many, many people were in it even before me, purely from a research perspective on how do we make sure care is really great.
Well, thank you for sharing the story. Thank you for sharing about patient experience. If people want to learn more about either the books that you mentioned, how to improve their own patient experience, how to train their middle leaders, where should they go? What should they do?
I think go to our website, Healthcare Plus Solutions Group. I think they can go on LinkedIn and subscribe to my free newsletter. We're still giving a lot of stuff away, both at our website, and they can always contact me at quint@quintstuder.com or 850-232-4648.
Well, thank you. I'm so happy I got to sit down with the father of patient experience.
Well, I don't know about that, but thank you.